Good evening, everyone, and thank you so much for coming out tonight. First, I'd like to preface with this. Since I will be discussing drugs and overdoses, you already had the trigger warning, but I want everyone to know that I'm not here to judge anyone's behavior. Everyone is entitled to making their own decisions, and I'm not here to critique anyone's lifestyle. In fact, my talk is actually centered around providing the help and support that any drug user needs. And to be clear, I'm not encouraging drug use, but I am advocating for every person to be empowered to live their lives in a safe way. So now I'd like you to imagine the following scenario. You're walking across the lawn after a late night party, and out of the corner of your eye, you notice a stranger collapse onto the ground. You rush over to check on them and realize they're overdosing. Everything happens so quickly, and a million things flood your mind. It's almost impossible to know how to react. And what do you do when every second counts? So now I'd like to ask you all, and just think to yourself, how many of you know someone, even including yourself, who's used drugs before, whether they were prescribed medications or illegal recreational drugs? And yet, how many of you carry harm reduction supplies? In fact, if someone right here, right now, right in front of you, were to overdose, would you be capable of providing any assistance besides calling 911? People will continue to use drugs, both prescription and illicit. So, since they'll acquire them anyway, we have to prioritize saving, not punishing them. And that's what harm reduction focuses on. We use strategies to minimize the negative effects associated with risky behaviors like drug use. It centers on the idea of meeting people where they are and what they're ready for in their journeys, rather than ignoring or condemning their lifestyles. It centers on the fact that everyone deserves safety and dignity. So instead of asking ourselves if drug users can change, we have to start asking, can we even escape drugs in the first place? And the answer is no. But we can outwit their outcomes and detriments. So how do we do that? Well, there's a new type of vending machine that's sweeping across the nation, but it's not satisfying people's midnight cravings. It's saving lives. Harm reduction vending machines are today's most cutting-edge solution in combating the opioid epidemic. And these machines are also known as HRVM, which is what I'll be referring to them as throughout the rest of this talk. So even though HRVM were first introduced to the US in 2017, they weren't implemented on a large scale until the COVID-19 pandemic hit. With the increase in overdose and mortality rates due to limited healthcare resources for drug users, people finally began turning to new solutions, eventually discovering the efficacy of HRVM. And there's a variety of benefits associated with these machines. HRVM distribute Narcan, and that is a drug that reverses opioid overdoses by quickly inducing withdrawal. I actually have a box of Narcan here with me today. So as you all can see, it's a nasal spray, and it only takes 1 to 2 sprays per nostril to help reverse an overdose. And Narcan is actually harmless because even if someone isn't overdosing, even if it's still administered, it won't have any negative side effects. So really, all it takes is just a few sprays to save someone's life. HRVM also distribute fentanyl test strips, which I also have here with me today. And these are crucial because many drugs nowadays, both prescription and illicit, are laced with fentanyl, which is a powerful, deadly opioid that's responsible for almost 70% of overdose deaths. However, if you use fentanyl test strips, you can check your drugs and ensure that you don't have accidental exposure to fentanyl, reducing the number of fatalities and overdoses we're seeing. HRVM aren't just limited to resources that are related to drug use. They also distribute COVID-19 tests, first aid kits, safe sex kits, and any other harm reduction supplies you can think of. Really just depends on what the community wants to put in their HRVM. And these resources can be distributed to anyone, both drug users and non-drug users alike, for free, 24/7. In many environments, especially college campuses, drug use is extremely common, which is why it's essential for us to have easy immediate access to these harm reduction resources, as well as people who are not only willing, but also prepared to treat anyone who overdoses. Because really, a few seconds can mean the difference between life or death. And whether we're talking about drug addicts, someone who's using drugs recreationally from time to time, or even someone who's using drugs for the first time in their life, anyone can be affected by this. Even people on prescribed medications can suffer from a drug overdose. For instance, many college students take Adderall to treat ADHD, or Xanax for anxiety and depression, both of which are highly addictive medications. And since these drugs are in such high demand, they often experience shortages, leaving these students turning to drug dealers or even social media for substitutes. However, many of these substitutes are laced with fentanyl, which can result in fatal results. It's also important to note that many harm reduction supplies, especially Narcan, can't be self-administered. I mean, think about it. If you've just overdosed, you wouldn't be awake or conscious to give yourself the medications you need. And in the CDC's most recent report, for 46% of fatal overdoses, there was a bystander nearby. Now, I want you to take a second to really think about that. Almost half the people who died could have been saved by someone who was just inches away. And maybe that bystander did want to help, but perhaps they didn't know how. Or maybe they didn't have the means or materials to do so. This once again reinforces the communal aspect of HRVM, because the more people who have access to Narcan and other harm reduction resources, the greater our chances of saving lives. However, as is with any other new concept, immense controversy currently surrounds HRVM, despite the plethora of evidence in their favor. Many opponents argue that HRVM enable or even promote drug use, because by their logic, if people have access to resources that can reverse their overdoses and save their lives, they're perceived as more prone to opioid use. However, allow me to offer a different perspective. Consider people with severe food allergies, and hear me out, because as someone who's had a life-threatening nut allergy my entire life, I can personally speak to this. When people with allergies carry an EpiPen, does that mean that they're going to start eating every single food they're allergic to just because they can save their life? No. The EpiPen is simply there as a precaution in case something ever were to happen. Because as hard as we might try to avoid an allergic reaction, there's always the slight chance of it happening unexpectedly. And in the off chance it does, we should be prepared with the necessary materials to treat such an incident. In the same vein, when drug users carry Narcan, fentanyl test strips, and other harm reduction supplies, does that mean they're going to consume more opioids on the basis of, I can save my life now? Who cares how many drugs I take? No. Those harm reduction supplies are simply there as precautions in case something ever did happen. Because contrary to popular belief, most drug users don't necessarily plan out when or how they'll use drugs. It often happens spontaneously, resulting in unexpected overdoses. And regardless of whatever activity people participate in, nobody wants to die. So let's backtrack. I'm from Cincinnati, Ohio, and we were the second city in the US to implement HRVM. In the spring of 2021, the University of Cincinnati partnered with the local nonprofit Caracal to provide an HRVM to the community. And since then, numerous cities have implemented HRVM programs in their health districts, clinics, fire stations, and even universities and college campuses. And speaking of which, many universities support harm reduction efforts. For instance, Professor John Frayer is known for riding his bike around Virginia Commonwealth University to hand out Narcan to students. And in California, they just passed the Campus Opioid Safety Act, which requires all public colleges to distribute Narcan and provide Narcan training to students at orientation. However, very few universities and colleges have actually implemented HRVM specifically. And here's a list of all of them. So we've seen across all these campuses that HRVM has proven effective in saving lives. So why can't we do the same at UVA? We all know UVA prides itself on the following. First, fostering one of the most innovative environments as a renowned research institution. Secondly, our top-tier medical program. And thirdly, our diversity in political beliefs and teaching systems, which gives us the courage and open-mindedness to take new approaches to helping others. Thus, the question isn't if HRVM should be established on grounds, but rather when. In fact, why can't we implement them now? UVA should become one of the first universities to establish these HRVM. We should set the precedent. Because realistically, we'll never escape drugs. Opioids, overdoses, they're all here to stay. And whether we're talking about habitual drug users, somebody who's using drugs for the first time, or somebody whose prescribed medications are laced with fentanyl, any one of us is susceptible to an overdose. And we can't keep up by sticking to our former solutions. I mean, they aren't even working. When addressing the rapidly evolving drug epidemic, we have to evolve with it. And HRVM are the transformative, modern-day solution we're looking for. And it's up to us to implement them. Because we, the students, especially here at UVA, hold the power. We are the change makers. And it's time that we use our power to not only recognize, but also endorse the immense impact that HRVM can have on our community. Because even if it saves just one life, isn't that worth it? Thank you.